and welcome to Guest Room. Today we have with us Robert Bland, who is a professor from Australian Catholic University, specialized in social work and mental health. Let's welcome him. Welcome, Professor.
Hi.
How are you?
Fine, thanks.
Right. Can you please tell me something about yourself?
I'm a professor of social work at the Australian Catholic University in Brisbane. The Australian Catholic University is a big university across the country. We teach a whole range of programs, but I'm the professor of social work. I've worked in community mental health, hospital mental health, other universities doing research and teaching around mental illness and social work for a long time.
So how is it going, the work?
I had a job at University of Queensland up until just recently, where I was specialising teaching mental health and research in mental health. And I've come over to the Australian Catholic University. It's much more a general kind of university training, so I'm responsible for all the social work programs at the university.
Well, Professor, recovery seems to be an all-new area in mental health. Could you please tell us something about recovery and its relevance?
In mental health, there's been this explosion of interest in the idea about how people recover from their mental illness. So rather than just seeing people as becoming ill and staying ill, and we're talking really about the more severe psychotic illnesses here. So there was an idea in the past that people didn't get better, that things would be bad for people if you got a diagnosis of schizophrenia or bipolar disorder, that you would have that forever.
Okay.
And what recovery does is to really say, look, you might have that illness, but let's see how we can help you live the best life that you can with that disorder. And so what it does is it focuses on things like people's relationships, their family, their work, where they live, their safety, their general health. All of these things become a focus for work. So instead of just diagnosing, treatment, maybe putting people in hospital or maybe just keeping people on medication, there's a whole range of places where we can actually work with people. And it does actually give people a lot more hope for their future if we focus on these other aspects. And the research evidence is really very clear that most people do recover. Okay. Most people who have serious mental illness will make some kind of recovery. Some will make a limited recovery, but most people will make a good recovery. And there have been these really interesting studies from the United States and elsewhere that have looked at people who've been inpatients in hospital for long periods of time, who 10 years after discharge, 20 years after discharge, are really much more stable. They're much more able to live in the community. Their mental illness symptoms have abated and they have a much better life. So we're much more hopeful about the long-term care of people with mental illness. That doesn't mean that the illnesses themselves are less powerful in disrupting people's lives and making people's lives very difficult and very distressing. Okay. The illness is still very powerful, but if we think about ways of helping people to live the best life they can, given the illness, then we actually can do so much more to help them.
Are you trying to say that recovery is not the complete solution to this?
I think what I'm trying to say is that putting people in hospital, putting people on medication for a long period of time isn't the solution. You know, that's important, and people do need good medical intervention when they're not well. But that can only do so much.
Right.
And in the long term, people's best outcomes depend on getting all these other things right. So, you know, confronting loneliness, for example, in people's lives, confronting the disruptions that happen within families, helping families to cope better with what's happened to them through the illness, getting people a job, getting somewhere to stay, secure income. All of these things we've learned from people with mental health problems. They say that they're the things that make a difference in their lives. If they can get those under control and working for them, they have a much better life.
You being a professor, what do you think are the challenges that you face while teaching the social work aspects to your students?
I think mental illness is a scary thing for a lot of people.
Yes, it is indeed.
And there's a lot of stigma. And so it's possible to learn about mental illness in courses like psychology or psychiatry that teaches you about all the different mental illnesses and how you treat them, the medications, the kind of therapies that are available. But really, in the end, helping, whether you're a social worker or a nurse or a doctor, is about a relationship with somebody and working with somebody closely to get the outcomes that you need. And that's scary for students. It's scary to get close to people who are very distressed, who may be very ill. It's hard for doctors, it's hard for psychologists as well. Social workers are the same. So that's the first challenge, I think. The first challenge is about seeing a person and not an illness. We learn all about the illness.
True, you need to know what the person is all about.
That's right. And you need to form a relationship with them. You've got to build trust. And you've got to have a lot of compassion, I think. And trying to help students to learn compassion, I think, is a real challenge. A lot of young people, and not just young people, but their lives are not touched by tragedy or sadness or distress, maybe till they're older. And so to actually get people to be compassionate, I think, is a huge challenge. And so trying to teach that through modelling, you know, showing yourself as a compassionate person, as a teacher, I think that's really necessary to help students learn that compassion. The whole mental health system is a very tough place to work. It's tough because the people who work in it are kind of struggling all the time to work out who does what. So what does a doctor do? What does a psychologist do? What does a social worker do? What does a nurse do? And so there's all this sort of challenge for authority and expertise in the treatment team.
Yes.
And it's hard for social workers to feel confident about what they do. So you've got to teach them about how to present themselves. They've got to learn an identity as a social worker and confidence to be able to work effectively in that team. And the reason they need to do that is that the clients, the people that they work with, will get the best service if everybody does the best thing, the right thing.
I think the world will be a much better place,
yes,
right?
Indeed, yeah.
So when does a person actually recognize that he has some problem, he is facing some issues where he needs to confront and seek a professional help?
Yeah.
And first of all, I believe it is not that easy, for a person to first self-realize that, I have some problem and I really think that, I need to confront this to someone and I need to take someone's help. What is that stage and what happens?
Yeah. There's a whole range of mental disorders on a spectrum, and some conditions are so obvious to the individual that they don't need any kind of reminder that there's a problem. So if you're very anxious, for example, that anxiety is very painful, very distressing and very obvious to you.
Right.
So you don't need somebody else to tell you, hey, it seems like you've got anxiety. You actually know.
Yeah, we actually know it.
Yeah. Depression is a little bit harder because a lot of people who are experiencing depression may not see themselves as having depression, but they may have all those symptoms. They may be withdrawn, no pleasure in their life, having trouble sleeping and getting on with their life, feeling very flat and very down. Often it's harder for them to see that there's something wrong. And then in the psychotic disorders at the end, people may very seriously challenge the idea that there's anything wrong with them. They might think, I can hear voices, but their voices are there, or everybody else is wrong. I've got these strange ideas about the world, but they're right and everybody else is wrong. So what invariably happens for those people is that it's people around them who recognise that something's wrong and have to confront the person and say, look, we really think there's something wrong. I'm not sure about India. In Australia, when people develop psychotic illness, it's often the family who have that kind of job of recognising that there's something wrong. And it's often the family that will talk to the local doctor or the priest or the friend or the family and say, look, I think there's something really, really wrong with my son or my daughter. And then there's usually a crisis of some kind as the person becomes really ill, and then help starts to happen. So there's that whole spectrum from people who recognise it themselves very readily to people who don't recognise it at all. Where mental illness becomes a problem is when it interferes with your life. So you can't do the things that you like to do. You can't mix with your friends. You don't feel comfortable about leaving the house, maybe. You can't concentrate on your work. You lose contact with your friends, and you have trouble with family. So when those kind of things start interfering with your life, that's when you need to get help.
All said and done, but when a person comes to you, I believe through someone they'll be coming, and not directly. But of course you'll be having a one-on-one session with the person who needs help.
Yes.
So how do you see them reacting, or what are the vivid various reactions that you get from your patients?
A lot of people, if they if they recognise the need for help, often very, very grateful for the opportunity to do something about what's wrong with them. Yes.
Okay.
If they see the need. The people that come into hospital against their will are often very resentful and very suspicious and very frightened. I mean, most people going to hospital are very frightened, so that's a start.
I also get a little frightened.
Yeah. And it's really important, it's the nursing staff mainly who can help people settle in.
Right.
So if they're respectful, and if they're prepared to listen to the person and express their intention to help as much as they can, that's very, very helpful. We've just done some research in Australia looking at people who have been in hospital on what we call Mental Health Act, so they're in hospital against their will. And half the people that we were interviewing were very angry and resentful, and they didn't want to be in hospital, and they still felt, after being in hospital for some time, that there was nothing wrong with them and that they needed to be out of hospital as soon as they could. But there was this other half who actually realised that being in hospital was helpful to them, that it interrupted their illness.
Right.
That's right. And that this was a chance for them to get better. So even though they didn't realise that they were ill, even though they didn't want to be in hospital, after a little while they realise that they do need that help, and they're very grateful then that somebody cared enough about them to put them into hospital.
Yes, they really feel left out, and that is the precise reason why they feel all depressed and, they feel neglected. So I think we should first inject that feeling that, we're there for you.
Yeah.
Right. So how do you think that the society, how do they react to differently abled people?
I think what you're touching on here is this whole issue of stigma. And stigma is that very powerful way of attaching a whole lot of negative ideas to somebody. So as soon as somebody says, I have a mental health problem, people attach all kinds of very negative expectations around that. That somebody's dangerous, that they're violent, they're not going to get better, that they're hopeless, this is a bad situation, that you don't want to have anything to do with them, you certainly don't want your son or daughter to marry them or whatever. There's a whole lot of very negative
it's like a negative vibe or expectation that people generally have when, they come to know that somebody is mentally ill.
Yes. And a lot of that's based on ignorance, and you really have to challenge it. One of the really hard things about stigma, I think, is that people who become mentally ill have all those negative ideas, like the rest of us. They start with those negative ideas. So they say, I've got mental illness, in that case I must be unpredictable, dangerous, have a bad outcome, not a person of worth. So that's called self-stigma, and it's very, very powerful. So how do you confront that in people's lives? I think one of the really important things to do is to remember that we're dealing with a person and not with a label. So I've got to know you as a person, rather than I've got to know this mental illness and all that goes with it. And you really have to encourage people to have higher expectations of themselves, to think big, you know, to have their dreams about what they want to do, and not to be weighed down by that very powerful stigma. And stigma is based on ignorance. You know, you have to confront the ignorance in order to confront the stigma. But it is very, very powerful in people's lives, and it lives everywhere. It lives among mental health professionals. You know, if you talk to consumers, people who've been mentally ill, they'll tell you that the most powerful side of stigma is mental health professionals themselves. The mental health professionals are capable of making people feel bad, making people feel hopeless, making people feel like there's no future for them. They're dismissed as a person. So among all the good mental health workers, there are also mental health workers that have those very negative expectations about people and can do a lot of damage as well as help.
Well, that's unfortunate.
It's very unfortunate, but it's all over. It's in lots of cultures.
Can you please tell us something about international social work?
We realise that social work is different in different parts of the world. So in North America, social work is much more individually focused. It's much more about one-on-one work with the individuals, more of a psychiatry counselling model. The UK, it's much more about the administration of mental health laws, so ensuring that people get the services that they're entitled to. Australia's kind of a little bit in between that. What unites us is this idea that social work in mental health is about the social context and the social consequences of illness. So people don't become ill in a vacuum. People become ill in a context. So they have relationships, they have family, they have community.
Yes, true.
And that's where you see the sort of expression of illness in that, especially in family. You see families reacting and struggling and wanting to care and wanting to help, and yet not always doing that well, you know, and being very stressed themselves and very traumatised. And the social consequences stuff is really about the impact of being ill on all aspects of your life. So how you think about yourself, but your friendships, your family, your community.
True.
What we notice about India, and this is my first visit really to India in a professional capacity, is that there's a very strong sense of community and family here that we don't have in Australia. So there's much more a sense here about how can we work with communities to help people? How do we work with people who are disadvantaged and mistreated because of their mental illness? How can we kind of restore people's social standing, their human rights? And this whole idea of using the community as a vehicle for change, it's very Indian. And you know, the rest of the world is very interested in that, because it's a very different way of doing things from this very individualistic way which we work with in the West. And we've had conversations over the last couple of days with Indian academics and complaining about, well, all our textbooks are from America or the UK. That's our problem too. All our textbooks are from America or the UK.
Okay.
And it's the local flavour that really needs to be acknowledged and really needs to be written about and come out. So we do things differently all over the place, but that idea of the social context and consequences unites us all.
So what do you think the differently abled person face in a society?
I think in our society, in Australia, what happens to people with severe mental illness, and I'm not talking about ordinary depression and anxiety, where people live in the community and manage with treatment really quite well. Where you've got severe mental illness, the most serious impact for us is really this loss of a sense of place and a sense of identity, that the illness becomes overwhelming and it takes away all the other kind of identities that people have. So people kind of lose their ability to be a worker or lose their ability to have a family. Lots of people with severe mental health problems are single people, and they're often very lonely and living in very isolated situations. So for that group with severe mental illness in Australia, that sense of isolation, that sense of loss of identity, sense of a loss of place in the community is very severe. And ironically, in countries like India and other more traditional societies, that's not so. You know, there's much more of a sense of people still having a place in the community. And families will care for people and communities will care for people in a way that they won't in Australia or North America. And so the outcomes for people with severe mental illness in India are much better than they are for Australia, for example.
So are you trying to say that being in a family, you know, traditionally being with your parents, with your relatives, with your cousins, affect you in a positive way?
It does. Yes, it does. Yeah.
So are you trying to say that you're trying to build in the same culture back in Australia?
We want to learn from what you do well here. So just actually getting the recovery stuff that I talked about before, about getting people a place to stay, helping people to make friends, helping people to get a job, they will restore that sense of identity.
Right.
That comes from that place in society that families and community give to people in your country.
So it's like a sense of being wanted by someone.
Exactly.
Being loved.
Exactly, yes. So central. Statistics are really very depressing when you read. You know, there was a big study done in Australia in the last couple of years, and as I said, you know, so many people with severe psychotic illness are single people living alone without a home of their own, and often with very few friends. So that's a very, very powerful, very negative consequence of being mentally ill.
So are you trying to say that although you should respect a person's or individual's privacy, but as much he or she needs the social element in his life?
Absolutely.
So what do you think is the government doing to extend all their support to the differently abled people, as well as in the social work?
Yeah. Australia spent a lot of money, like a lot of Western countries have spent a lot of money on mental health in the last 30, 40 years. So we've had new mental health plans and policies and projects. There's been an attempt to, as much as possible, treat people with mental health problems in the general health system, rather than isolating people in psychiatric hospitals. Instead, we have wards in public hospitals, trying to treat people in the community as much as possible. And there's been a big growth in non-government organisations supporting people using recovery-based projects. The other things that are really crucial to this, which mightn't seem immediately obvious, are things like income support. So there are pensions for people who are mentally ill that provide them with enough money just to live on.
Just to live on.
Just to live on. And pharmaceutical benefit schemes. So their drugs are subsidised, their healthcare is subsidised. So they're important parts of that system too.
So Professor, how do you think has it affected your life, you know, working with the social workers and working for the differently abled people?
It's been a great passion in my life. Of course, I've really loved that work. So my clinical work, when I was a social worker, before I became an academic, I was working in a hospital with families of people with mental illness, and that was hugely rewarding, getting to know those families and to work with them in a structured way. And you could really see people responding very positively to the work we were doing and getting some control in their lives and feeling much more connected. And then I've had a career as a teacher, and so the real joy there is helping students to think about mental health practice in a very special way. You know, I've been keen for students to learn to be that compassionate social worker that I want them to be, and not just to learn a whole lot of stuff about mental health, but to learn how to be a compassionate worker and to take the job very seriously and to do it well, because there are huge rewards for doing it well. So that's been fantastic, and so it's been very enriching in my life, and it's made that's been my career. Yeah.
I think the best reward you get back is love.
Yes, yes, indeed. The respect and affection of your students as a teacher, but of course there are many people, families and people with mental illness that I've worked with, who've taught me so much. Yeah.
They teach you, and of course, you know, they must be respecting you for who you are,
yes,
and for helping them out, you know,
yep.
to get them back to the social life.
Yep. Yeah. It's been rewarding.
So, do you have anything, you know, you want to advise anything to the public?
I think one of the really important things is to confront that fear about mental illness, and you know, people with mental illness are not them; they're us. You know, we all have people whom we know who have mental health problems. Many of us have mental health problems ourselves, and we know about it in our families. So just confronting that idea of there's us and there's them, that's really how we have to stop that, because the people with mental illness, they're us.
Thank you, Professor.
Thank you.
Until we meet next time, this is Chitira signing off.